Hello, everybody. We are getting ready to get started now. So there's about 5 of us on. You can see me. Hello, my name is Vic Owak with Ageless Medical. And today we're going to be doing a IPL demonstration on Rebecca over here. We have Lisa Materia and Lauren Thompson over here that are going to be assisting with this. The presentation is going to be about 15 minutes. We're going to have like a little presentation and discussion, and we're going to do some before and after pictures. And then right after that, we'll have some question and answer here where you can submit your questions. I think that is it. So Lauren is going to go ahead and take it from here.
Hi, I'm Lauren Thompson. I have been with Ageless Medical for about 3.5 years now. I've also been doing laser for over 10 years at this point. So I do the IPL treatment, a little bit of hair removal and skincare, and then we work, Lisa and I work together doing these treatments. So hand it over to Lisa.
Yes, hi. So I'm Lisa Materia. I've been at Ageless Medical now for over 11 years, which is unbelievable. It flew by. I love every minute of it. So I do the majority of the consultations here in the office. I do the IPL, laser hair removal, E-matrix, and all therapies. So hopefully I'll have an opportunity to meet with each of you. I'm so glad you joined us today. We're really excited. We have our wonderful patient here, Rebecca, who grew up in South Florida, like all of us except Lauren's a child. So spent a lot of time in the sun, did wear sunscreen. We all claimed that we knew nothing about sunscreen at the time. So what we're going to do today is we're going to help Rebecca get rid of all that wonderful pigmentation that's been lingering around for several years. So what we've done is we're starting to prep Rebecca. And we saw when you first came on, I was putting Lux lotion on her face, which will prepare the skin for our treatment. We have her goggles on now beforehand, just to give you a little bit of how she prepared for this. We started preparing about 2 weeks ago. We had Rebecca refrain from going out in the sun. And if she was anywhere near the sun, we have her wear physical sunscreen. We stopped the retinol, any tretinoid. We stopped glycolic, salicylic, lactic acids, any irritants 2 weeks beforehand, any hydroquinone, any bleaching creams, just to prevent anything, any in the skin being compromised at all before we treat her. And so what we're going to do, we're using today the Icon. This device is really gold standard, top of the line technology. And what makes this technology so much more superior than any of the other IPL devices out there is because we have what's called a skin tell. This is one of a kind. There is no other device on the market that has this type of technology. And what it does, it actually reads the pigment, the exact pigment and melanin in your skin. So what we're doing is we're customizing this treatment specifically for your needs. So we're getting the best treatment that we can possibly give to you at the safest, doing it safely, at the safest. So we're going to go ahead and let me demonstrate how that device works. So this is the skin tell. This is the device that's actually reading the exact pigment in Rebecca's skin. So there's no lying and telling me you didn't go in the sun, because I'm going to know you did, okay? So what we do is we just go over the area, just 5 little touch points. She's not feeling anything at all. This device, again, is just going to read and give us an accurate reading. Okay, Rebecca didn't lie. She wasn't in the sun. We're good. Okay. So again, what we're treating today with Miss Rebecca is her pigmentation. Now, this device is not limited to pigmentation. We can do flushing, redness, rosacea, broken capillaries. We do photofacials, which is all about rejuvenating the skin as well. So but this particular patient is really concerned about her pigmentation, so that's what we're going to address today. So her setting, which I've already put in here to the device, is basically set for pigmentation. A little bit more.
So Lisa's just scrubbing the skin with the Lux lotion again to make sure that there's a little barrier between the laser and her skin, and there's a little bit of slip for her to move around.
So Rebecca, what you should feel when I pulse through your skin, it's just going to feel like rubber bands snapping, and you're going to feel a little bit of heat, okay? Kind of like a slight sunburn. But what we're going to do, like we always do when we get started, we always do a test spot. And what we're looking for is, we're basically looking for the spot to change maybe 1 to 2 shades darker. And then when Rebecca leaves, she's going to look like she has a slight sunburn, a little bit of darkness to the spot, but over the next, I'd say 3 to 5 days, the pigment's going to be cooled to the surface. It's going to get darker. And then ultimately, we want it to flake off, kind of like coffee grounds. Okay, so we're going to do a little test spot. How did that feel? Just a little snapping? Yeah.
So she just said she hardly felt that little snap.
Yeah.
Yeah. If anybody can hear her.
Sorry. So let's crank it up. All right. So we're going to get started. Let's get a little, it's about 1 or 2 shades darker. So we're going to go ahead and get started, and we'll do her entire face.
So with these IPL treatments, a lot of patients come in worried about pigmentation, redness, and overall tone of the skin. A lot of us have been out in the sun, outside a bit more this summer with kids, with, just getting out of the house. So a lot of patients are coming in seeing more of that pigmentation. So it's really great to start addressing that at this time and being able to get you ready for the winter months here in South Florida.
So I've asked Rebecca from 1 to 5, 5 being the most discomfort where she's at. And you said what, like a 2?
Yeah, it's consistently a 2 right now.
Okay.
It's not bad, actually, at all.
Okay, so you're feeling like a little bit like a sunburn?
Tiny bit of heat.
So she's feeling just a tiny bit of heat.
So throughout this treatment, you'll see Lisa lift her glasses just to take a peek at the skin, because what we're looking for is that pigment to get a little bit darker. So that's where Lisa knows she has her endpoint. With these treatments, we do recommend about 3 treatments for the patients about every 4 weeks. What that's really going to do is that's going to target that pigmentation and bring it to the surface, and then it'll actually, with our natural exfoliation process, will actually end up coming off, or we can add a treatment onto that, like a microdermabrasion, a dermal infusion to take that top layer off.
And the good thing too, not only are we adjusting the pigment, because we're doing the full face and we're doing a photofacial, she gets a lot of rejuvenation, stimulation of collagen, just the tone, the overall appearance of the skin is changing. So, not to be mistaken that we can only do it for pigment. But we have a lot of patients that come into Ageless Medical that don't have a lot of pigment, are just looking for the rejuvenation aspects of the photofacial.
It really will give her a glow in the next 2 weeks after those dark spots have flaked off.
I have a question that came in, on the other procedures about products.
Okay.
Does she have to take any products or any other products after she leaves here that will help or?
Yeah. So we do have a couple of options as far as aftercare. We do typically pair this treatment with our brightening cream. The only thing with the brightening cream, it does contain a retinol, so we ask that you start that about a week after your treatment, use that for about 2 weeks, and then stop using it again before you come in for your next treatment. That's really going to help with inhibiting that melanin and also helping to slough off that top layer. Another thing we recommend is our sunscreen. So we have a couple of ingredients we like to look for in sunscreen. Physical blocks are really what's going to help keep that pigment at bay. Now, patients tend to sometimes think that they can go back in the sun and get sunburned and not protect the areas because their skin looks better. but we really like to make sure that our patients take care of their skin after these treatments so we can keep that pigment away. Also a little bit of vitamin C during the day. I can go on and on about product. But a little vitamin C during the day so that acts as your barrier from the sun or your antioxidant once your sunscreen becomes inactive.
You know, it's so important. That's good that you brought that up, Lauren, because there's not one modality that addresses everything. It's incorporating, it's, you know, it's like going to the hairdresser, right? And you're spending a fortune to get your hair colored, and then you go to Walgreens and buy your shampoo. It works hand in hand. It gives you, it just enhances your results.
Right.
And
And protects your investment. You're investing in your skin. So it's a really good investment.
Rebecca, how are you doing? And then you have any questions?
I guess one of my questions is, so I know we have the typical 3 treatments and they're about 4 weeks apart. If you don't go out in the sun, how long on average before you would come back, you know, to get that look again?
Can you repeat that question?
So she was asking if she sticks with the regimen of the 3 treatments every 4 weeks, how long should she expect that pigment to stay away? I would say a good 6 to 12 months would be a good gauge. You know, it also depends too on the amount of heat that's applied to the skin, because heat does create a little bit of a melanin kickback also. So I always tell patients, even after doing hot yoga, taking a run outside, when you're using your sunscreen, that's going to help protect, but also splashing the skin with a little bit of cold water post-treat or post-exercise will help to bring that heat down. So I would say about 6 months, 6 to 12 months, depending on lifestyle.
And then would it be just one more treatment, or would you do the whole regimen again?
Usually it just depends on the patient, but I would say maybe a touch-up here and there, maybe 1 or 2 treatments.
Okay.
Maybe once a year would be very sufficient for patients.
So,
some patients like to come in just for the photofacial, just for the rejuvenation.
Exactly.
so Debbie, Andy, a couple other folks there. I can see Karen, Alicia. Do you guys have any questions? Go ahead, please, and, you know, put them in the chat area as well. Got a couple of you, you know, any questions as we're going along, send us over here and we'll make sure that those are answered. You may have answered this, but after they get the 3 procedures, is it 6 months, 3 months? When do you think, I mean, could it last even more than a year?
Yeah, but so the 6 to 12 months is where I would say they would probably need some sort of a touch-up.
Okay.
But I would say, yeah, it could definitely last up to 2 years, just depending on the patient's lifestyle and their at-home care.
Gotcha.
That really makes a big difference. A lot of patients too would like to know who is the best candidate for this treatment. Typically, it's skin type 1 through 3, and we ask that patients are out of the sun and reduce all of their glycolic, salicylic, and retinoic acid for about 2 weeks before they.
Can you define a 1 through 3, what that means?
It's a Fitzpatrick scale. That is the tone of your skin. So, Lisa, how do I explain that?
What would I be?
Yeah.
We would say you're about a 2 on the scale. You know, eye color, hair color, all have to do with how our skin responds to the heat of the laser.
What would
Somebody that has a lot of natural pigment to their skin, you know, olive skins, Mediterranean,
Yes,
you know, right, like, you know, somebody maybe Greek, dark Italian, dark eyes, dark hair. What happens is we're going for pigment, right? But they have this underlying pigment already, so it becomes very problematic.
yes. It's hard for the laser to decide what pigment to go after.
So how about for me, someone with my skin type? Where would I be?
I'd say about a 2 or a 3.
So this is kind of my skin type here. You can see a
Depending
little
on when you've been
pigmentation.
out in the sun.
Okay.
Yeah,
I have another question also.
yeah.
Can you use it on other parts of your body?
So Rebecca just asked if she can use it on different parts of the body, and the answer is yes. And we usually like to stick to arms, hands, chest, and face. Lower parts of the body, being here in South Florida, tend to have a lot more exposure, so you don't get as great of results.
So I'm going to go into now some before and after pictures, which Lauren's going to help me here with a little bit. So I'm going to share my screen and go over a couple photos. These are photos from the manufacturer, and then there's also some photos that we have from our patients.
So this patient had a lot of pigmentation on the right side of her face. You can see that she actually had 3 treatments done. So this was done every 4 weeks. You can also see the tone of her skin. She actually has a really nice glow with that heat and creating a bit of fibroblasts with her skin. This patient, she had her chest done. She also had 3 treatments. With this patient, as you can probably tell, she spent a lot of time in the sun. So we were able to actually get her back to having pretty clear skin, but that's where she has to make sure that she's protecting herself when she goes back outside. This is the patient's hands. Hands can be a little difficult because we're drying all the time, but this patient really saw great results in those hands. And then also, if you look at the veins, it looks like she had a little bit of a thickening of the skin also.
Okay. Yeah.
Feeling more?
No, I want to do my hands next.
Rebecca's already deciding what areas she wants to do after her face.
So we would ask Rebecca to wear gloves when she's driving
Yes.
for 2 weeks.
Gloves for sure. And this is another chest for a patient. As you can see, the texture and the tone have actually changed with this patient's treatment also. This was also another 3 treatments. This is an arm.
Yeah.
So this also is an arm. A lot of patients call them liver spots or sunspots, and it looks like this patient also had the 3 treatments and had great results. This is rosacea. So a lot of patients have redness in their skin with a condition called rosacea. So what this laser does is it pinpoints the the redness on the skin. It coagulates the blood vessels, which means it shrinks the blood vessels, and then our body metabolizes it. It's really great for those who have this issue, but we always ask that you see your dermatologist first if you have any medications that the dermatologist has you on.
Talk a little bit more about, the other, the red capillaries, rosacea, some other areas that you've seen patients come in that not at this particular setting, but with this device treated.
Yeah, so this device treats the redness. So a lot of patients too sometimes can have a little bit of trauma to the skin, redness around scars, things like that. It actually can address the redness around those parts of the face or even the chest. And then if patients do have rosacea, they're seeing a physician, we ask if your skin is clear because some patients can have little breakouts with that condition. So we just ask that your skin is clear before you come in and be off your medication.
And then we're treating the appearance of rosacea.
Yes, we're treating the appearance of rosacea. It's definitely not a cure, but it'll help with the redness. And this is another before and after of a patient who had some pigmentation. As you can see, some of those little pigmented spots are very light still, but we were able to get a majority of those areas. This patient also, as you can see, around the eye area, the rejuvenation portion of this treatment really helped with those fine lines.
Okay, we have some questions in. The first question came in, can you use facial moisturizer with no retinol prior to treatment?
Yes, you can use it up until the treatment. When you come in, we just clean your skin off properly, so there's no barrier between the laser and your skin.
Another question came in from Karen. Can large areas be done? I have significant age spots and sunspots on my arms and upper thighs.
I would definitely say we can do the arms. The upper thighs are a little bit more difficult because parts of the body don't respond as well. We could do the arms in one treatment, but sometimes you may want to break it up into 2 different sessions.
And maybe even do a test area, you think, on that area?
We could definitely do a test area on the thighs just to see how it responds.
Okay. Well, that was Colleen saying, what she was using for the moisturizer. So, Debbie, I have spots on my hands. I have a sunscreen, but with the amount of hand washing we're doing now, is it possible to still get this done on my hands?
Yes, it definitely can still be done on the hands. Even with all the hand washing and hand sanitizer we're using right now, I would just make sure it's not an exfoliating hand wash. And then before you come in, we'll definitely prepare the area properly, and then we do ask that you wear gloves post-treatment to keep up with those results.
Okay, Andy, Victor, I don't hear Lauren as well as Lisa or you. So thank you, Andy. I appreciate that. And Colleen, you're welcome. I see your thanks here. So I appreciate that. The machine's kind of loud here, so I keep my thumb up a little bit. So it's Lauren and me's not hearing, but Lisa, which is interesting. So I appreciate that, Andy.
So right now, Lisa's actually doing a post-cool to the skin. What we're doing is bringing down some of that heat and inflammation.
How's that feel? That's good.
And then after this treatment, she can always go home and use some little ice packs. Sometimes I recommend patients to put little washcloths, wet washcloths in the refrigerator just to give a little bit of soothing relief after the treatment when you go home if you do feel like it's a little inflamed.
Rebecca, how do you feel?
It's really not that hot, to be honest with you. I was expecting it to be more.
So, you know, at the height of this, from 1 to 10, where were you, you know, as far as the level of discomfort when this was going on?
From 1 to 10?
Yes.
Maybe a 3.
Okay.
I was consistently at the 2 when we did 1 to 5. So
Okay.
it wasn't painful. It was just a sensation.
Okay. I wish we could see this guy. Sorry, I got to get a zoom on my camera here. So we are going to just spend another minute. We're going to close off, but I want to give, if there's any other questions, or Lauren or Lisa, any other things that you want to talk about before we close out. You know, and I'm going to also be posting this so you can kind of watch it again online. Lisa, anything else that you want to talk about, or Lauren, about the procedure?
As far as downtime, a lot of patients ask downtime. I wouldn't consider this treatment downtime, but always remember that the pigment will get a little bit darker before it gets lighter. So if you have a special event coming up, you have photos to be taken, this is definitely not something to do right before. It's something you would do maybe, 4 weeks out from that.
How about putting makeup on after?
Immediately after
Well, not
treatment,
right after.
yeah, I would not recommend. If anything, we could put a little sunscreen. But other than that, I'd kind of just let your skin breathe for the rest of the day. Let the pigment come out, and then tomorrow morning go back to your normal, makeup routine.
So would tinted sunscreen be okay?
Tinted sunscreen would be perfect.
That's my makeup.
Yeah.
Anything else, guys? I want to say thank you to everybody, especially you, Rebecca. We really appreciate it. And if you have more questions, info@agelessmed.com. We'll be posting this. And thank you, everyone, for your time. Bye-bye.
Bye, everyone.
Thank you and bye.